Hello, good evening, and welcome to this evening's workshop, Vicarious Trauma, How to Cope and Care for Yourself as You Care for Others. I'm Dr. Nicole Monteiro, clinical psychologist and CEO of CHAD, Center for Healing and Development, where our goal is to help improve the mental and emotional health and well-being of our individuals, families, and communities. So I'm so glad you decided to join us for this online workshop where we are going to discuss the very important topic of trauma, how it affects us when we're exposed to it, and what we can do to cope with it. So before we get started, whenever I do this talk, I always try to get people to get in a frame of mind. And so I suggest, if you can, get a notebook or something to jot down, because we'll have certain reflections throughout the workshop where I'll ask you to think about your own situation and circumstances and jot some things down. I know it's a little bit late, but if you can get a cup of coffee or tea or juice or water, something that you can sip on, and most importantly, bring an open mind to think about the way that trauma is affecting our communities and affecting us individually, and take a deep breath as we think about these things. So for consideration, if you were able to get that notebook or pen and pencil, I want you to think about, how are you exposed to trauma in your life? What are the ways in your personal life, in your professional life, in your exposure in the broader community and society that you are exposed to trauma? And what have been the costs of this exposure, as well as potentially the benefits? There's something called post-traumatic growth, or growth and resilience from trauma. So have there been any benefits of you being exposed to the trauma and suffering of others? But also, what have been the costs of this exposure? So I always like to start with a quote that sort of helps bring into focus the topic of trauma. And so there was a memoir by Jessica Stern called Denial, a Memoir of Terror. And she says, some people's lives seem to flow in a narrative. Mine had many stops and starts. That's what trauma does. It interrupts the plot. It just happens, and then life goes on. No one prepares you for it. So I thought this was poignant, because what she's saying is life goes on, but life as you knew it does not go on. The plot, the narrative is interrupted. There's starts, there's stops. It's incongruent, it's fragmented. And that's sort of what trauma does. It takes us from being whole, or as whole as we were before, and sort of breaks us into pieces. And in some ways, that's what our exposure to the trauma of others does as well. So let's think about, first of all, what is trauma? Trauma is huge and big in the national conversation. It's becoming more and more relevant. Even Oprah Winfrey had a discussion with a very important trauma clinician and scholar, Dr. Bruce Perry, talking about the impact of childhood trauma. So this is really in the culture right now. So I always tell students that trauma is sort of this overwhelming event, that catastrophic, overwhelming event that overwhelms our capacity to cope. So we have stress, which is, can affect us, but we have coping mechanisms in place that are usually able to help us manage the stress, at least to some degree. But trauma is above and beyond. Some say, in the one psychological definition, is that trauma is injury or the consequence of an unexpected and violent intrusion into the individual system that has an effect upon the whole organism. And I'll talk in a little bit about how trauma affects so many different systems in terms of how we think, how we behave, how we feel. So it's a holistic event that impacts us as a whole system. An emotional wound or shock that creates substantial lasting damage to the psychological development of a person, possibly leading to neurosis. So what we really mean by that is that the event happens, it's over with, but the impact, the ripples continue. The potential damage, the potential negative effects continue long after the event happens. And so this idea that a traumatic event, an overwhelming catastrophic catastrophic event happens and then it's just over with and you move on, that again is not necessary. That's not true, right? Even when when we talk about resilience or overcoming, that is a process of dealing with the lasting effects of trauma. Then quite simply, an event or situation that causes great distress and disruption. So again, like the quote said, things get interrupted, disrupted. What things were like before, they can no longer be like that again. All right. And then from a formal psychiatric definition, trauma is defined as exposure to actual or threatened death, serious injury, or sexual violence in one of the following ways. So directly experiencing it, witnessing someone else experiencing it, learning that it occurred, that this happened to a close family member or friend, or repeated extreme exposure to these adversive details of traumatic events. For example, first responders and people who are like humanitarian workers who are consistently exposed. But now that's becoming more and more a broader segment of the population through events happening in their communities, whether it's mass shootings, whether it's shootings, in the neighborhood, in the communities, in urban communities, that we are repeatedly exposed to these extreme details of traumatic events. So again, direct experience, and it could be anything from an accident where someone was maimed or dismembered, to serious, the threat of death or someone else close to us experiencing serious injury or death. And then some of what the field is really focusing now are those early experiences of sexual violence, physical violence, emotional and verbal violence that have this negative, ongoing negative effect, okay? And usually part of trauma is the person's response. And so from a psychiatric perspective, the response is usually intense fear, a sense of helplessness, or horror at the events that took place. And as we were saying earlier, trauma affects the entire person. Everything from what we call our affective systems, how we regulate our emotions. We all know that on a day-to-day basis, there are numerous emotions that we might be experiencing. And part of what we have to do to get through our lives, through our days, is to be able to manage them, to regulate them, to figure out when we're going to express some emotions, how to deal with other emotions that might be more overwhelming, and so forth. Also, our behaviors, our capacity to manage how we respond. So when we feel something, how do we respond? How do we respond to stress or conflict, right? And normally, even when under stress, we are able to find ways to manage our behavior, even undesirable behaviors. But in the context of trauma or after a trauma, our capacity to regulate so much of what we do in our lives is really diminished. Our relationships, our ability to form healthy attachments, particularly if trauma happened early in a person's life, as well as our capacity to continue with the attachments or the relationships that we have currently. Cognitive systems, including how we think, how we learn, how we pay attention, how we're able to focus and not get distracted, that's impacted. Developmentally, particularly with early childhood trauma, the capacity for someone to reach particular milestones in terms of what's expected of them physically, emotionally, psychologically, and socially, that's affected. And then even on a somatic or physical level. In particular, sometimes if a person experienced trauma really early before they were able to talk and express themselves verbally, the trauma will be significantly expressed through their body. And there's a lot of talk now about the ACE study, or the Adverse Childhood Experiences study, which showed that these adverse traumas, essentially they're traumas that children experience, the more of these traumas they experience and for the longer they experience them, the higher likelihood there is that they would experience physiological and medical problems later in adulthood. Things like chronic illnesses, what they call metabolic illnesses such as diabetes, hypertension, even going on into addictive behaviors, other risk-taking behaviors, cancer, other forms of chronic serious illnesses, that these are all associated with a higher number, or likely a higher number of early childhood traumas or adverse experiences. So trauma is really this holistic experience that affects so much of a person's body and mind. And so what are some of the responses? So I'm not even talking about the particular diagnoses. So we know now that post-traumatic stress disorder is really one of the primary diagnoses, psychiatric outcomes or psychological diagnoses that comes along with trauma. It's a whole constellation of symptoms and experiences that come about when a person has experienced trauma in many cases. And so, before we even get to the diagnosis, what are some of the specific symptoms or signs of trauma that an individual might experience? They include things like being edgy or agitated, easily startled, we call it hypervigilance, difficulty concentrating, being hyperactive, having difficulty sleeping or insomnia, nightmares, daydreaming or zoning out, having vague, fuzzy memories, numbness, feeling emotionless, a sense of feeling tired and fatigued, engaging in these self-injurious or self-mutilating behaviors where you're cutting, even though you're sometimes people do it, young people do it because they feel so numb, they want to feel something physically, or they do it because they have so much emotional pain that they want to distract the pain into something more physical and tangible. A sense of irritability, anger, combativeness, aggressiveness, of easily, engaging in conflict, or on the other hand, avoidant and depressed, sudden mood changes, or having a mood and the way you express that mood, your expressions might not match. So some people might feel sad inside, but express that as anger or even silliness or laughter. General fears and anxieties, a sense of guilt or self-blame and even shame that something's wrong or defective about you, a sense of hopelessness, and even rejecting help. And two common responses to trauma on a broader scale that are really prevalent in our society now are substance abuse. We know that there's a significant focus on the opioid crisis, but even before that, there was a significant drug problem in many communities that was ignored, but so much that's at the root and core of the substance abuse addictions are early traumas. Things like, I can't tell you the number of patients I've met with substance abuse problems and addictions who have had early sexual abuse, early physical and verbal abuse, neglect, being moved from institution to foster home, not having a stable living environment. That all of this contributes to substance abuse, as well as what we often see as risky lifestyle behaviors, things like engaging in risky physical behaviors, putting yourself in harm's way, sexual behaviors that are unsafe, that put your life at risk or put your emotional and physical health at risk, that these sometimes are two ways of coping with some of the traumas that might be prevalent or ongoing in our lives. Okay. So I wanted to talk about the brain a little bit. There's no way to really talk about trauma without talking about the brain. And there's a lot of research now that's really looking at the effect of early trauma and that early childhood adverse experiences on the brain's development, right? So the brain, there's so many ways to divide it, but we can talk about it in terms of the early reptilian brain, sort of, which regulates things like respiration, coordination, all of those autonomic functions. And then what we call the limbic system here, which is also a pretty ancient part of the brain, but it regulates a lot in terms of our emotional response, particularly primitive emotional response to our environment. And then what we call the neocortex, this is sort of that really thinking part of the brain, particularly the frontal and prefrontal cortex, where we do things like thinking, planning, decision making, impulse control, and so forth. So usually it's important to think about the response of the body and the brain in the face of a traumatic event. And that starts with how we respond to danger or threat. And we have, I'm sure you all have heard of, the fight, flight, and now we add freeze response, where in the face of an immediate danger, our systems have been built, we've been developed to be able to respond to threats without thinking about it consciously. It's almost an autonomic process that starts in the cluster of neurons where what we call the neurotransmitter epinephrine, or is related to adrenaline. These hormones are able to activate us to do things physiologically that we weren't able to do normally under normal conditions. But then after that, there's a fear response that is activated in the amygdala, right here, and part of the limbic system that regulates those emotions. And that's where that emotional memory, it's not even necessarily a cognitive memory with words, but it's a feeling, and that gets stored in the amygdala. The other part of memory, what we call narrative memory, where you can put a story and a context to what happened. I always give the example of putting your hand on fire, near fire. You move your hand away, you might even feel scared, you might have this automatic reaction outside of words. That's the amygdala working. The narrative part is where you can step back later and say, oh, well, I was cooking, I forgot to use a pot holder, I didn't take, my hand got hot and burned. That's the narrative part, and that's stored in another part of the brain called the hippocampus. So what happens is whenever there is danger or the threat of danger, usually our response comes straight, we have a message that goes straight through to the amygdala. And usually when someone has been significantly traumatized, they respond to situations, to triggers, to situations that remind them or are similar to the traumatic situation. They respond as if it was an immediate threat and danger in front of them. They lack the context. Their brain sort of gets activated. We call it shooting from the amygdala, where they respond without the whole story, but just with that immediate danger, fear, threat response. And we call it shooting from the amygdala. And so that brain activation of the limbic system of the amygdala is a really important part of what gets triggered in people who have experienced significant trauma. So now what we really want to focus on is vicarious trauma. So we've learned a little bit about what happens with trauma in general. Vicarious trauma is sort of being traumatized, not directly, but indirectly because of the work that you do or the role that you have taken on. And so when a person is repeatedly exposed to the trauma of others, usually through their work or some sort of helping role, whether it's being a doctor, a therapist, a teacher, a caretaker, someone who is an activist, that you're exposed to the trauma of others. And vicarious trauma is when that person experiences a form of traumatization that can have negative effects on her or his well-being. This is a process, okay? And there's an organization called the Headington Institute that does some really great work. And they do work with humanitarian workers, people in conflict zones, and they define vicarious trauma as the process of change that happens because you care about other people who have been hurt and feel committed or responsible to help them. What they're saying is because of your level of empathy, care, and commitment, you actually may go through your own process of transformation because of you caring. We sometimes call it the cost of caring. Over time, this process can lead to changes in your psychological, physical, and even spiritual well-being. So what are we saying? We're saying that this is a cumulative process. It's not a one and done, I heard a traumatic story and now I'm vicariously traumatized. That this is something that usually happens over time, usually in small, fits and starts without you even recognizing it. And it is due to your exposure to human suffering, essentially, exposure to clients or other people that you work with to their stories and struggles. And this is an ongoing process. You are continuously changed by your exposure to trauma. It's not, again, something that you just wake up and it happened without any build up and then it's over with. It's cumulative and it's usually ongoing, which is why it's so important to take care, to really think about it, how to prevent it, how to intervene, and how to counteract the vulnerability that you have when you care for others. Again, we call this the cost of caring, the empathy and commitment that you exhibit, that you demonstrate, that you embody. The fact that you care and are committed to helping is part of what makes you vulnerable to this transformation that can have some positive aspects. Many people say they are profoundly moved by the work of witnessing and trying to alleviate human suffering. Others, though, find that it takes a significant toll because of that vulnerability that comes from the empathy and level of commitment that they have. Another part of the cost of caring is the what we call the effect on your spirituality and worldview. And this is with trauma overall. The fact that trauma involves catastrophic, often horrific events that sometimes, many times, are at the hands of other human beings. That can really shake the core of your worldview, how you see humans, how you see yourself, other people, how you see your sense of purpose to a higher power. It can really affect those things, and so can vicarious trauma. It can affect your sense of hope or belief in what you do. Maybe sometimes you might feel like, why am I even doing this? This is not having an effect. The problem just gets bigger. I feel hopeless. There's no use. And again, as I said, the way you see yourself in relation to the world and others. So one reflection, just to take a minute, if you have your pen and pencil, is to think about, how does your commitment to your work and the people you care about help you? Okay. And then on the other hand, how does it hurt you? How does your commitment to your work and the people you care about help you? How does it hurt you? Okay, and this can be in any capacity. It could help you because you see the beauty in helping others and the way, the human resilience, the human capacity to forgive and to move on. It could hurt you in that on the other end of the spectrum, you see the capacity for wrongdoing, and some might say evil, at the hands of other human beings, and that could really affect you. It could hurt you because maybe physically the role that you take on is just so exhausting or tiring. Whatever it is, just take another couple of seconds to reflect on that. So there's a really profound and important pioneer in the field, Judith Herman. She was one of the first people to really talk about what we call complex trauma. And that's that ongoing trauma that occurs oftentimes in the context of a relationship with someone who was supposed to protect you, like abuse at the hands of a caretaker, or a caretaker not protecting you when they knew that you were being traumatized and abused. So Judith Herman, she talks a lot about this complex trauma. And what she says is, particularly with complex trauma, so much gets disrupted on a core level in terms of the person's capacity to trust, their sense of autonomy, or that they can, be independent and effective in the world, their initiative or their motivation to do things, their sense of competence or self-esteem, their overall identity in terms of who they are. Who am I that I was a child that was, abused by my parent? It can really affect your identity and also your capacity for intimacy. And so because this type of complex trauma affects, particularly early childhood abuse, affects how we relate to others, Judith Herman and others say that these must be healed and restored in the context of a relationship. But for the person who is in the caretaking or healing role of that relationship, the healer, the therapist, the doctor, the caretaker, the teacher, the first responder, whatever it is that you're doing to try to alleviate suffering, there's so many stressors that come with that. Okay, so the consequences of an intense healing relationship, or any sort of relationship where you're alleviating suffering, could be several things that are all related: compassion fatigue, burnout, secondary trauma. And they're all related. Compassion fatigue is sort of this gradual decrease in compassion and empathy. Burnout is this exhaustion or collapse, total physiological or psychological or mental collapse from overwork or work-related or role-related stress. Secondary trauma is the distress from hearing about traumatic experiences of others. And that's the same as vicarious trauma, but we think about vicarious trauma more as a process, a larger process. But secondary trauma is that immediate distress upon hearing about traumatic experiences. I've talked to colleagues who said, I sat and heard one of the most horrible stories of child abuse that I've ever heard, and I can't stop thinking about it. I'm having nightmares. And so there is that immediate distress from hearing the trauma of others. And there's a really great social worker who's in the field of helping to work on vicarious trauma. Her name is Laura Lipsky, and she has a book called Trauma Stewardship, which is excellent. And she really says that looking at vicarious trauma and self-care in the context of vicarious trauma is really about taking a big picture view. It's not just, okay, when I'm stressed out, do I go to the spa? It's really taking a big picture view, stepping back and asking yourself some really profound questions. Why am I doing what I am doing? Why is it that I'm doing the work that I am doing? Okay. Whether it's your role as your professional, work role as a healer, or your personal role as a caretaker or a caregiver. Why? What are the specific reasons? You might say, "Oh, I have to do it," or "That's what I majored in," or "That's my parent, that's my relative." But specifically, why are you doing it? Are you doing it taking care of your parent because you feel an obligation and you feel it's an honor in some ways? You feel like it's better than the alternatives. Whatever the specific reasons are. Then you have to ask yourself, she says, what will be my focus? What specifically? I can't do it all, right? But I have to, in order to be effective, focus. Some people think about that in their professional lives as a specialty. Okay, a teacher. Are you early childhood education, and you're really good at communicating with parents about the child's strengths and weaknesses? Are you an upper school teacher, high school teacher, where you really are good at looking at that student that's on the edge of falling behind and mentoring them? Okay. Are you a clinician, therapist, where you're really good at thinking about how to, impact systems where people are not getting the type of treatment that they need, right? Whatever your focus is going to be. Who will be my community of support? This is vitally important. This work, this cost of caring requires that we have support, and support within a community. Just like Judith Herman says that the healing relationship is what's curative. Well, for a healer, for a caretaker, someone exposed to human suffering, a community is what is going to protect you. Thinking about how will I achieve balance in my life consistently? How will I center and ground myself? So this is what we call the trauma exposure response. This is what, Lipsky calls it the transformation that takes place within us as a result of exposure to the suffering of other human beings or the planet. And this is a really expansive definition because it means even people, environmentalists, biologists, people who are working and seeing the negative effects of things like climate change on the planet, that they can even have this. It's a traumatic exposure that they're experiencing. So this trauma exposure response is this cycle of ways that we are impacted by this indirect, or what some people might say is direct exposure to trauma. And it includes things like a sense of hopelessness or helplessness, a sense that you can never do enough. You can pour your whole self into your role. You're taking care of someone in your family, and they're still, they have Alzheimer's or dementia, and no matter what you do, they still, are not able, you're still not able to do enough to alleviate their suffering. Hypervigilance, always on edge, hyper anxious, nervous, always looking for the next thing to circumvent, or a diminished sense of creativity. So part of what is the opposite of a trauma response is the capacity to feel joy and excitement and love and creativity. Okay, and so with repeated exposure to trauma, that capacity is diminished. Inability to embrace complexity. So many problems that we're dealing with are really complicated. They require, being able to look at subtlety and nuance. But sometimes it's easier to get into very black or white, yes or no, up or down, this or that thinking, and not embrace the complexity of other people, of situations, and that makes it easier to vilify other people as well. Minimizing, so almost like normalizing the trauma and experiences of others as well as ourselves. Then we have chronic exhaustion and physical ailments. The inability to listen or to deliberately avoid. So with the people close to you, your relationships, you've poured so much into other people that it's hard for you to even be present for the most important people in your life. And continuing, we have what we call these dissociative moments where you might disconnect. Consciously, something is sort of overwhelming for you. And there's a certain level of dissociation. It's normal. We all do it. We can't attend to all this stimuli in our environment. But so there's a certain way we disconnect. But when you find yourself zoning out, daydreaming, kind of having to be kind of shaken back to get with it, if that's happening a lot, that's a sign. A sense of persecution, guilt, and fear. I put those together where an individual feels like people aren't appreciating them, are out to get them, don't want to see them succeed. That you have to kind of step back and look at that. That's related to anger and cynicism. Are you feeling like nothing is right? You don't trust anybody. You don't think, and this is different than some people say, well, I'm just a realist. But when you're feeling particularly negative and angry and cynical about the intentions of everybody around you, that's a sign. The inability to empathize, or you starting to feel numb, that's that compassion fatigue. Again, as I talked about earlier, the addictions, overly relying on substances and so forth. And then on the other hand, grandiosity, this sense that an inflated sense of importance, that you are the most important person doing this work. I've seen people who are working in marginalized communities and being advocates and activists, but sometimes I can tell that they are potentially going through a process of vicarious traumatization because they vacillate between being completely cynical to then feeling like they have the only answer that can rescue this. It's almost like a savior complex, right? So that's, again, very extreme and out of balance. Those are some of the trauma exposure responses. And so there are many different levels of risk for experiencing vicarious trauma. One is what we might call personality or individual risk factors. And that includes things like your individual style. How do you tend to cope? Are you someone that's more of an, you go through your emotions? Are you a problem solver? Are you someone that represses and denies? Do you try to jump right in? What is your own personal history of exposure to trauma, direct exposure to trauma? Is that something that gets triggered through the work or the role that you have to take on? What is your current life situation? Are you stressed and overwhelmed? Are things out of balance in your life currently where that makes it harder for you to manage that vicarious exposure to trauma? And also, what are the levels of support or lack of support that you have in your life currently? And then there are other levels. So situational, if you are exposed to trauma through your work, what is it like at the organization where you work? What is your professional role? What are the population of people that you're working with? All right, some communities have levels and layers of intergenerational trauma that is just so complicated and layered that it can really be overwhelming to work with the population without some level of support. And then on a cultural level, what is the culture of your profession? Some professions it's hard to ask for help, like first responders. Even teachers are expected to sort of get there early and be the latest to leave. What is the broader culture's way of expressing distress? Are we intolerant? Do we not even want to hear people having negative feelings or emotions? Or if they do we expect that they have a quick fix and get over it easily? So these are the different levels, and this applies even if you have a role in your personal life. What are the levels where it's your personality versus what's happening in the situation in the broader culture? Even thinking about how does the culture how do we take care of people who are in caretaking roles? Do we have compassion for them? Do we offer support? Do we offer a space to vent? Do we offer, the kind of material resources and support that they may need? So here's a minute for you to reflect. What are the pick three individual risk factors that put you at risk for vicarious trauma? So remember, we said there are different levels of risk factors here, and one of them is personality or individual risk. Things like your typical way of coping. Are you just not good at sort of managing your work, personal life, the way you manage momentum? Do you get sleep? Do you tend to not eat? So forth. Like, what are your ways of coping? What's your personal history, your current life situation, and support? So pick 3 individual risk factors that might put you at risk for vicarious trauma. And then think about what are 3 things in your life that can help protect you from vicarious trauma. Right? So remember, we talked about social support, or maybe you have a very positive sort of routine or ritual that helps you to get through your day with energy and vitality, right? Maybe you have a group that you meet with on a weekly basis and you all play games and it helps to relieve stress. Or maybe you have a peer group that you go to for consultation and help with difficult situations in your professional life. Maybe you have a group of girlfriends or guy friends that help support you through your personal trials. Okay, so whatever those 3 things in your life that help to protect you from vicarious trauma. So let's talk about how do you cope, right? So we know in some ways that if you're in a role, if you're in a position where you're sort of exposed repeatedly to other people's trauma, to other people's suffering, you will potentially, there's a high likelihood that you will be transformed, that you will be affected by this exposure. So how do you cope with it? One important thing is self-awareness. Awareness is really important. Not recognizing the signs is very detrimental to even being able to prevent or intervene. So recognizing the signs, we went back and we showed you some of these signs of the trauma exposure response. We even talked about some of the ways, the trauma responses in general to direct trauma, right? Are you experiencing any of these? Agitation, difficulty concentrating, hopelessness, guilt, blame? Or are you experiencing some of these other larger trauma responses, such as the anger, cynicism, sense of persecution, minimizing, diminished creativity, and so forth? All right. So the first part of coping is to recognize the signs, and you can just look at those lists and think of other signs that you think might be relevant and write some of them down. That's the first step. And then assessing your risk and protective factors. So that's what we just did there. Asking you to think about what are some of the risk factors that put you at risk and what are some of the things that protect you from vicarious trauma. And then identifying self-care strategies that work, right? So I think self-care is coming into more awareness, which is great, but it's starting to be talked about in some settings in a very cookie cutter way. Self-care, go to the spa, go to the gym, right? That may be part of your toolbox, but it can't be a cookie cutter approach. You need strategies that work for you. And there's this framework from the Headington Institute that I referenced earlier, where they talk about self-care strategies needing to encompass three things. We call it ERP. Escape, where you need some activities that help you to get away. Rest, which is where you just get to relax with no particular goal or timeline in mind. And then play. That's sort of the part of, what's a need that we have as human beings is joy, playfulness, fun, lightness, right? And so having self-care strategies that focus on escape, rest, and play are very important. ERP. And so self-care, just to look at it more specifically, it is a set of regular practices that help us to reduce stress and maintain well-being. Reduce stress and maintain well-being. And this includes behaviors such as promoting health and such as diet, exercise, getting regular checkups and so forth. Managing stress on a day-to-day basis. What do you do when you encounter situations where you're overwhelmed or your schedule is packed or things are just coming at you? What strategies do you have to manage that? Are you engaging in mindfulness, deep breathing, trying to come up with a more realistic schedule, right? Life balance overall. Self-care is really about some people would say work-life balance, but it's really just life balance. How are you balancing the multiple roles, the multiple obligations that you have in your life? Caring for your relationships. We all know that social support, social connection are vitally important. What are you doing to nurture and foster these relationships? And then overall, attending to your needs, your emotional, psychological, and spiritual needs. And this is really about looking at the whole person. Self-care is not one aspect, but it's holistic in terms of practices that maintain your well-being through these different avenues. So it's really important to come up with what we call a self-care plan. And in the link to this video, you will see links to 3 worksheets that you can actually complete. One is a lifestyle self-care assessment. The other is an emergency self-care plan, and the other is a self-care reassessment or maintenance plan. So the lifestyle self-care assessment is where you actually look at what you do now. there is such a thing as negative self-care behaviors. So some of us, in order to try to cope and take care of ourselves, we actually engage in behaviors that can have a negative impact. So you want to be able to assess right now the level or the degree to which you are engaging in negative self-care behaviors, and then also positive self-care behaviors, and what the balance is. Negative self-care behaviors are things like smoking, using drugs, a lot of drinking, not eating, not sleeping enough, spending money carelessly, getting into debt, maintaining destructive relationships, people that are either abusive or exploiting you just because you stay in it just because you feel like you have no option, or that at least they're there for you, and watching tons of TV without doing any other activities that are stimulating. Okay, and then on the other side are some of the positive self-care behaviors that include things like a regular routine or ritual that sustains you, that gives you energy and revitalizes you. 6 to 8 hours of sleep, sufficient water, trying to eat healthy, trying to get regular exercise, engaging with people close to you, and engaging in relationships that are stimulating to you. Okay, on the negative side is a lot of social withdrawal, even more than some people are kind of solitary by nature, but if you're isolating and withdrawing even more than normal, that's something to look at. So on the positive side is engaging in fulfilling social relationships. Okay, and then on the next level we have what we call the emergency plan, and that is where you think about if you were to encounter stress or difficulty above and beyond what you encounter on a day-to-day basis. If someone were to get into an accident, if you were to be sick or hurt, then if you were to be faced with a certain level of work or things that your children are going through at school, or someone that a family member that you're taking care of has an emergency, what is it that you are going to need to cope in that situation? So when you click on the link, you should go to that emergency plan and think about things such as a list of people that you can call in an emergency if you need someone to take you to the hospital, or take a family member to the hospital, or help pick up your kids from school, or help you to get groceries, or pick you up if your car is not working. Whatever it is that needs to be done in an emergency, you need to actually start thinking about who are the people you can call on. And for some people, this is difficult to do because they sometimes come to the realization that they don't have as many people as they thought they would have, to assist them. And, that's just a wake-up call to say, what other relationships do I need to try to develop and nurture? The other thing is, what are some things? So part of what happens when we're under extreme stress is we tend to engage in negative self-talk and self-blame. When things aren't going right, we blame ourselves, or we feel hopeless and helpless. You need to come up with some positive self-talk statements that can counter some of the negative talk. Some of the positive talk can include things like, I'm trying my best. I'm down, but I'm not out. This situation is unfortunate, but it's not my fault. I have hope that I will get, that things will get better. Or, I may have made some mistakes in the past, but I'm turning the corner and I'm trying to make things better now, right? Whatever's positive self-talk, I'm a committed, whatever your role is. And people need me in their lives, so I'm going to continue to try to get through this. Whatever it is that you need to say to kind of counter some of the negative self-blame, guilt talk that creeps in when we're in stressful situations. And then what we call a reassessment and self-care maintenance. So this is something the same way that you have to go get your car oil changed every 3 months, every 3 to 5,000 miles. It's the same with us, particularly when we're in these roles that expose us to vicarious trauma. So what is it that you need to do to maintain your level of self-care and reassess? Has your lifestyle changed to the degree that you actually need new tools? Previously you were able to exercise 3 times a week for 20 minutes and it was enough. Now maybe you're feeling like you want to do some different kinds of exercises. You want to incorporate yoga or stretching. Maybe previously you had a certain, diet, but now you feel like your days are getting longer for whatever reason, or it's winter time or the weather changed and you need more vitality. You want to look at different foods to incorporate. You might feel like, well, it's winter time, I'm not going out as much with my friends, so maybe we need to figure out other ways to keep in contact, either by phone or making sure that we keep those commitments for weekend plans because they're not as frequent. Whatever it is that you need to do to reassess what your plan is, and then to maintain, and then to look at what are the barriers. And I find, as we're ending up, one of the most significant barriers to self-care is the fact that we minimize our own problems, our own stress, our own sense of being overwhelmed, and we do not think that we need self-care. Sometimes we're working with so much suffering that we can minimize and disregard our own suffering, our own pain, our own difficulty. And that, I can tell you, is a recipe for disaster. So this idea of reassessing and maintaining and looking at barriers to even engaging in self-care. And for many people, it's a mindset. The other thing I tell people, some people say, I just don't have time. Deep breathing and mindfulness, stillness and visualization are 2 of the most impactful self-care strategies you can start today. 5 minutes a day of slow, they say deep breathing, but we really have found that it's slow breathing that really helps the oxygen to move throughout our body, to slow us down, to relax the central nervous system. 5 minutes a day, starting with that. 5 minutes of sitting still and meditating. And you might say, I don't know how to meditate. 5 minutes of just sitting still and noticing what you feel like in this moment, what you're noticing, what sounds, smells, sensations you're noticing in this moment. 5 minutes of that. That's a very concrete, tangible, achievable goal that you can start, practice that you can start to incorporate. And then rewarding yourself afterwards to make sure that you give yourself credit for even engaging in any of that. And then you can go on to the bigger things like yoga or taking walks or making yourself a nice, healthy, tasty snack, or treating yourself to see your favorite movie, or going out to do something fun that you used to love in childhood. All of these things are vitally, vitally important. And giving yourself permission to experience joy and fun and excitement. And a lot of times, like I said, part of the issue is the guilt about doing that. When you've been exposed to so much suffering, you feel guilty, you feel like you don't have a right to, and so it creates a vicious cycle. So those are the things that I wanted to talk about in terms of what trauma is, the way trauma in general affects the brain, particularly early childhood trauma, how vicarious trauma affects us who are in professional or personal roles where we're exposed to human suffering and where we are committed and we care. And then what are some ways to look at understanding our exposure to vicarious trauma, the symptoms and signs of that, and then coming up with our own personal self-care plan. Thank you so much for joining. This is Dr. Nicole Monteiro with CHAD, Center for Healing and Development, talking about vicarious trauma, how to cope with the cost of caring for others. Links will be in the comments section of the video, and feel free to contact me with any questions that you have about the topic. Thank you for joining.